Here's a heartbreaking reality that every parent needs to face. Vaccination schedules exist for a reason that goes far beyond what most people realize. Health authorities in Los Angeles County are sounding an urgent alarm following the tragic death of a school-aged child from an extremely rare measles-related condition called subacute sclerosing panencephalitis, or SSPE. What makes this case particularly devastating is that the child had contracted measles years earlier as a baby, well before reaching the age when measles vaccination becomes possible. But here's where it gets controversial. This child initially appeared to make a complete recovery from the measles infection. The family likely thought they had dodged a bullet. However, the measles virus had been silently lurking in the child's system, eventually triggering SSPE, a condition that Los Angeles County Department of Public Health officials describe as not just rare, but universally fatal when it develops in individuals who experienced measles during their earliest years of life. The timing of this announcement on Thursday has sent shockwaves through the community, as health officials are now making an impassioned plea for residents to ensure their vaccination status is current. The tragedy underscores a critical point that many parents might not fully grasp. The measles virus can remain dormant in the body for years before manifesting as this deadly complication. And this is the part most people miss. SSPE typically develops years after the initial measles infection, creating a false sense of security for families who believe their children have recovered completely. The condition represents one of the most insidious aspects of measles, its ability to cause devastating consequences long after the initial symptoms have disappeared. This raises some uncomfortable questions that deserve honest discussion. How many other children might be walking around with dormant measles virus in their systems? Are we doing enough to protect infants who are too young to be vaccinated? And perhaps most controversially, should there be stricter policies regarding vaccination requirements in communities where vaccine-preventable diseases pose such long-term risks? What are your thoughts on this tragic case? Do you believe this should influence how we approach vaccination policies? Or do you think the current system adequately protects our most vulnerable children? Share your perspective, whether you agree or disagree with stricter vaccination measures.